and welcome to the Art of Being Human. I'm continuing to work with diabetes, talking to you about the complications and everything that arises. And occasionally I'll think of something like I did this week that I hadn't shared with you, and I don't know how important it is, and I don't know if you're doing this, but I just want to say one more thing about insulin syringes. I've brought them in before. They basically have two caps on them, and the first cap you pull off. This is one I've never used. The reason the cap is there is to protect the syringe from dust and so forth. Now once I pull this cap off, I never put it back on. You can, but you're already opening up the syringe to whatever is around. But my concern is the other cap. What do you do with it when you're giving yourself a shot? I know, and I've seen people do this. They stick it in their mouths and then give their shot, proceed to take the insulin out of the bottle and give themselves a shot. Then they take it out of their mouths and put it back on the syringe again. Now, this is a simple thing to do if you're in the bathroom, or if you're in a restaurant, or if you're at home, or in your car. Maybe you take your syringes and take your insulin in the car. The problem with putting a cap in your mouth isn't so much the fact that your mouth is unsanitary. That could be a problem. But what if you have a hiccup or you start to sneeze? You could take an uptake of air, a fast uptake of air, especially if you're having a hiccup or a cough or something, and that little thing could slide down your throat very easily, and you could have it stuck in your throat and choke to death. And I thought of it, I don't know why I thought of it. I saw somebody do it the other day. They're sticking it in their mouth and they're working with it. They've got the insulin bottle in one hand, they've got the syringe in the other hand, and of course you have to use two hands. How else can you do it? So they stick this cap in their mouths, and the thing is, if something happened and you swallowed it, you could choke to death from it. So I'm just reminding people that's not the best thing to do. The best thing to do is to put the cap somewhere. Find a place to put it. If you're in a bathroom and there's no place, get a little tiny case or something to drop it in, and then put it back on when you're finished. Don't stick it in your mouth, because a sudden sneeze or something like that could draw that right into your throat, and then you could really be in danger. Now, I don't know why I happened to think of it, but I did happen to think of it. And once in a while, when I am preparing for a class, I think of something that just comes to mind that I hadn't mentioned before. That's just an extra precaution to protect yourself from any kind of harm that you might get. There are enough dangers in having diabetes to begin with without adding one more. So what I want to go now to is these charts. I want to show you a little bit, give you a kind of review, and show you a little bit about what I call the chain of events of what happens in diabetes. Then we'll go on into illnesses, we'll go on into the way that the body fights diseases, the immune system, and so forth. So let's look at this chain of events. Diabetics, as you know, have excess glucose. As glucose, it's sugar in the blood, but it's called glucose because what you eat turns out to be made into glucose, and that goes into the blood. So the blood becomes sticky, and the circulation slows down because sticky blood can't flow normally. It gets stuck in the little blood vessels, especially in the hands and the feet, the extremities. Now, the nerves are damaged by the high glucose, and they cannot fire normally. As you know, nerves fire off impulses to other nerves, and that's what causes a lot of the activity of the body. It can't do it as well. So already, if you're diabetic, you have sticky blood, poor circulation, or it's going to become poor, and nerves that don't work right because of the fact that the high sugar makes it impossible for them to fire normally. So you have that to contend with. If you have an injury, you may not feel the injury due to the nerve damage, and the circulation is slow. So therefore, the injury gets worse, it gets deeper, it gets infected because it doesn't heal. It doesn't heal because the blood blood flow doesn't go very fast to the injury, and cells need to have the blood flow. The nervousness, the nerve damage prevents you from healing, and so you have a complication that's already set up. So the high blood sugar slows the immune system. The white blood cells attack the bacteria and the viruses. The high blood sugar makes the white blood cells less effective, and sometimes they are not even able to reach the infection. And then the slow circulation may not allow white cells to reach the bacteria. The bacteria feed on high sugar, making the infection worse. So therefore, this is your situation. You're diabetic. Your blood is slowing down, the circulation is slowing down because the blood sugar is too high. The nerves aren't firing impulses because the sugar is damaging them, so they can't do what they're supposed to do. The white blood cells are not able to fight the infection because they're damaged, and they can't function because of the high blood sugar. And sometimes, because of the slow circulation, they're not even able to reach the infection, or they're slow in reaching the infection, and then you can't feel enough because the nerves are damaged, the nerves don't work right, the circulation doesn't work right. The bacteria, by the way, feed on the high blood sugar. They love the warmth of the blood, they love the sugar. So therefore, they're getting more and more, the infection is getting more and more pronounced because, after all, the bacteria like to feed on the high blood sugar, which the white cells are having trouble reaching to fight it off, and the nerves are having trouble working because of the fact they're damaged. So you are made for a massive infection if you're diabetic. Now, a lot of times we fight these things off because of an immune system, but the immune system can be compromised too because of diabetes, and so therefore you don't have the strength or the ability to fight off the infections that you're used to, and you don't feel so much because of the nerve damage. Now, I've said that diabetes affects every nerve and every cell in the body, and that's true. And what I'm trying to do is just to kind of show how that works, that every cell in the body is affected. So you have to take care of yourself every day. You have to do a good job of taking care of yourself every day. You need to check your feet every day because they're going to be really impacted by diabetes, especially the feet, the hands also. But then you get symptoms of neuropathy because the nerves are so damaged, so you're in pain, and everything just kind of works together against your health if you're diabetic. And so that's why I say, of all the chronic illnesses, and they're all a pain, they're all difficult to deal with, they all have their own kinds of symptoms, but you are, as a diabetic, in danger of getting into trouble much more frequently, I think, than some of the other chronic illnesses. Not that any chronic illness is easy to deal with. It's not. But there are just so many complicating factors that affect all of your cells and your nerves, everything about you, all of the infections that you can't fight off, all of the injuries that you get that you can't feel, and so therefore you don't know you have them, all the infections that get chronically mishandled because your body doesn't know what to do, it can't work normally. So it is an illness that you have to watch yourself. Now I want to mention about ulcers. Everybody can get an ulcer. It's not hard to get an ulcer. You know, people have ulcers in their stomach, and some of them get big, and some of them bleed. And if you have a bleeding ulcer in your stomach, sometimes you have to have surgery to correct it. So ulcers start off with a little infection, and then they progress to being kind of like a hole. And they get bigger, and they get deeper. They get so that they bleed, and sometimes the bleeding can cause cells to die because of the poor circulation, and that may lead to an amputation. Now, people do get ulcers everywhere. You can get them in your stomach, you can get them on your skin. Concern for a diabetic is not to get them on your feet. And if you have calluses, I want to get into that. Let me just put this down. Well, let me just mention about infections first. Diabetics get a lot of infections, and they get them everywhere. And I have a list here. The mouth, the gums, the lungs, the skin, the feet, genital areas, incisions after you've had surgery. There's less feeling due to the poor circulatory system. There's less feeling due to the damage to the nerves, so you don't feel the injuries or burns or cuts. You don't feel them necessarily when you get them. Now, sometimes you do, but a lot of times you don't. So you can have gum disease and you can have foot ulcers, and all of these make your life miserable. Now, I want to mention the calluses. Calluses are a thickening of skin, and it's usually on the feet, and it's due to the fact that when you wear shoes, your shoes may not quite fit properly. You have your foot in your shoes and there are pressure points, and maybe you don't have special diabetic shoes, and so therefore you're getting pressure, especially around by where the toes are, and you can develop these calluses. Now, calluses are serious. They don't necessarily hurt unless they become thick, and then they can hurt some. They can be taken off. A foot doctor will take them off. They'll take a little knife and just take them off. But the problem is with calluses that if they open up, you can get a massive infection. It can cause a massive ulcer in the foot if they open up. So if you have calluses, go to your foot doctor regularly and let them take them off, and they have to watch and make sure that they don't open up so you get a wound there, which would give a massive infection. The feet are especially in danger, and if you're going to have a partial amputation, it's usually a toe or a foot or something that gets taken off, because those cells are tiny. Those blood vessels in the extremities are very tiny, and sticky blood has a real hard time flowing through them. And when the cells don't get the blood supply that they need, because they operate on glucose too, then they die. When they die, they become necrotic, which means they become black. And if you have a foot that's turned black, it usually has to be removed in order to protect you from your body from dying, because it will spread. You can't let that happen. So people do lose limbs as being a diabetic. It's one of the things you have to watch for. Now I'm going to start talking about infections. And I have my notes here. Rather than putting them up, I just want to tell you I'm going to talk about C. diff. I don't know if you've ever heard of it, and I'm going to talk about MRSA. Now, C. diff, also called C. difficile, it's Clostridium difficile. That's the name of it, but they just call it C. diff. And that's what I want to talk about first. And it is, you don't maybe hear much about it. I hadn't heard much about it. And now it's getting more play in the press. And it's one of the infections you can get. And diabetics may get it more easily maybe than other people. But C. diff is a bacterial infection in the colon. I don't know how much I want to go into this. I have a ton of information about it. Usually you have a balance of good bacteria and bad bacteria in the colon. If that gets out of balance and the bad bacteria take over, then you can get a condition called C. diff. C. diff is a bacterial infection in the colon. It is extremely dangerous. It is extremely contagious. I'm surprised that so little has been published about it, but I'm beginning to see more and more about it as I read and kind of scan newspapers and so forth. C. diff bacteria grows and disrupts the bacteria in the colon, and it gives a massive infection. Now, it's easy to catch. It's extremely contagious. If you are taking care, say you're a nurse's aide, if you are taking care of a patient with C. diff and you and you're wearing gloves, hopefully, it is so easy to catch. You put your hands on a patient to wash them. There's a little hole maybe in your glove, or maybe you're not wearing gloves, but you should be, or you get a hangnail. That gets into your system. And if you're in a restaurant and a person has just been to the bathroom that has C. diff and they haven't washed their hands, what happens is they put their hands on the counter and they haven't washed their hands. You come up behind them, you put your hands on the counter without thinking anything about it, and just any little nick in your skin and the bacteria will get in and you'll have it. It's dangerous. 15,000 people a year die of it. and you keep getting it back. It's so hard to fight it because you keep getting it back. And when it comes back, you're given antibiotics to kill it. And then if the antibiotics aren't the right ones, then they can set it up again and it starts all over again. This illness comes back so that you may be without symptoms for 3 days, you think you're over it, then it comes back. Some people have had it 19 or 20 times before they get rid of it. Some people, they've actually had to do surgery and take out part of the colon because it won't get well. And the bacteria just keep coming and coming and coming. It's just very hard and very contagious to get rid of. It is treatable, and eventually people do get rid of it, but a lot of people end up by dying from it. 15,000 people a year said. Very high, it's dangerous. And the main symptom is a very odd diarrhea, an odd looking diarrhea. From bleeding in the colon, it's reddish and a very odd smell. And there are other ways of treating it. You can use, some hospitals will do this, to put a fecal implant in a person. And believe it or not, if you're bad enough so you need a fecal implant, it will usually cure it within hours, and 96% of the people who have a fecal implant get well, and get well very, very rapidly. It's not known why the fecal implant works. They can put it in a nasal tube and put it in your intestines. They can put it in with a colonoscopy, but however it gets there, it stops the symptoms, absolutely stops the symptoms. Within an hour or two of having the surgery, a person feels much better. Now, why do I bring this up? Well, I bring this up because it is so easy for people who are diabetic to get infections. It is so easy for them. All they have to do is just get a little nick and get a bacteria in it, and they don't have the reserves to fight it off because the blood system is first of all compromised with the high sugar and all of the things that happen that I mentioned on the charts that I've showed you so far. It is a real problem, and so you have to be very, very careful of your sanitation, and I've discussed it before. If you are a diabetic, you need to be careful anyway. Now, I want to talk about MRSA. We've all talked about MRSA. We've heard it. It's MRSA. This is what it is, MRSA, methicillin-resistant Staphylococcus aureus. Doesn't it make you sound smart to say that? A lot of times, I talked with the nurse about MRSA. You usually get it in a nursing home or medical facility, and it's any infection or any bacteria that is completely antibiotic resistant. In other words, if you have it, and you usually get it in a nursing home or medical facility where there's a lot of bacteria hanging around, and if you get it, there is nothing that will stop it. There are people that die of it, and you find people in nursing homes that have lived there for a long time. They have it. There's no way to stop it. It is completely antibiotic resistant. So they always go through the MRSA, and it's any infection that you have that's completely antibiotic resistant. I saw a show in which a young girl was being interviewed. She had it. She's about 18 or 19 years old. But her immune system wasn't strong enough to fight it off. And she was getting nodules and little lumps here and there as a result of it. And there was no way to fight it. And your immune system has to fight it for you because antibiotics will not work. And if you are a resident of a nursing home, have been a resident of a nursing home for quite some time, you probably already have it. If you have worked in a nursing home for quite a while, you probably already have it. Now, I used to belong to a little group that went to nursing homes to do services. I still do services in nursing homes, but I also used to help out and do concerts in nursing homes. We had a little group of guitarists, and I did woodwinds, and we'd go into nursing homes. And every week we'd be going somewhere. And when we finished with those little concerts, which the residents loved, the first place we headed was the bathroom to wash our hands hands. Even though we weren't interchanging with the residents of the nursing home, we weren't putting our hands on them, we weren't cleaning them, we would shake their hands maybe, but just to protect against MRSA. If you have a good immune system, you probably won't even know you've got it. You won't have any symptoms of it. If you have a poor immune system, then you'll get the symptoms and you'll get the nodules and you'll know that you're sick, but you can't fight it off. I suppose they try with antibiotics, but it's considered to be completely antibiotic resistant, and people do die of it. Residents of nursing homes die of it. But if you are a diabetic, you are just much more prone to anything that's anything that's antibiotic resistant. You're more prone to infections. You get infections more frequently. They last longer. They're harder to fight, partly because your blood sugar is high and the blood can't function right. The nerves can't function right. The white cells can't function right either because they're being affected by the high blood sugar. So everything I mentioned in terms of diseases and illnesses are 3 times more dangerous to the diabetic than others. So we are going to close it here because we're about out of time, and I'm going to go into something else next time, but I am going to also be talking about the immune system. So please join me next time.